All right, guys, this is going to be a quick home video on how to set up neck traction for cervical radiculopathy. So just real quick of overview, cervical radiculopathy is when we have a pinched nerve up in the neck or cervical spine that is causing radiating pain symptoms down the arm within a particular nerve root distribution. So what we want to do to that is if we can take the neck and we can distract it, we open up what's called the neural foramen, which is the hole that nerve root exits out of the cervical spine, and it opens up and increases the space around the nerve root to take pressure off of it. So what we want to do, you can do this with a non-pliable strap. This is a resistance band, so it's got a little bit of give to it, but you could certainly rig up a couple belts and accomplish the same thing. But you want to come to a doorknob or a banister rail or something that we can attach this to. And so you loop that around the doorknob, and you need to kind of tinker with your position a little bit. But ultimately what we're trying to do is scoot our body out away from that door enough that we feel the pressure start to be relieved off of that nerve. And you really just want to be able, I'm going to get my ears out of there. You really want to be able to just let your head totally relax. And again, the farther you scoot out, the more pressure that the strap provides and the more distraction force you get. So typically I tell people like start in neutral with the neck to where you're just looking straight up towards the ceiling. Some people might find it more comfortable, let's say it's a left-sided radiculopathy, to side bend the head just slightly to the right because that'll open up that nerve root even more. You could also rotate slightly to the right to open that nerve root. Having said that, the goal is to work back towards neutral to where you don't have to rotate or side bend away and to where the nerve root pressure is relieved enough with just the distraction in neutral. We would want to use that for about 10 minutes. And I'm okay with you doing it, 2 to 3 times a day. This is something, guys, that if you're trying this stuff at home, you need to be communicating with a healthcare provider, a physical therapist, to make sure that you're doing it at the right duration, at the right intensity for the right reasons, and that what you are feeling is appropriate for this intervention, because these can go the wrong way pretty quickly if you're doing the wrong kind of intervention for it. So if you're having any abnormal sensations, you've got to be checking in with somebody to make sure that those are okay with the person who's prescribing this treatment for you. But overall, 10 minutes or so, 3 times a day. And what I really like to do is when you set this up, you don't want to put so much tension on this that it takes all of your symptoms away immediately. What I tell people is usually you want to move out to a distance that it takes about half of the symptoms away. And then over the course of 8 to 10 minutes, the rest of those symptoms might start to calm down. A lot of times what happens though is we scoot out a little too far, our symptoms go away almost immediately, but then 5 to 8 minutes in, they actually start to creep back up, and you're getting what's called a traction reaction, where we've separated the system a little bit too much and the muscles are trying to guard. Your nervous system has kicked in and caused the muscles to guard, and then which recompresses that area and it aggravates the muscle tissue around the nerve root. No good. So aim for about 50% relief when you start the traction. And again, if at any point during the traction you start to feel things get worse, you may want to scoot back and gently let up a little bit on that. So a lot of times it helps the first couple times you're doing this to have somebody there with you so that you can just get into position and they can kind of bring the band to you or things like that. But that's ultimately what the setup would look like. It's a great option for home traction, saves you a lot of money. Those home traction units are usually about $350 each. And this works really, really well. So try that out. Let us know what you think. But again, you've got to be communicating with a provider. If you're trying this one, I wouldn't tell you to do this if you're just kind of like self-diagnosing and going on at it on your own. Because again, if you've got a cervical radiculopathy, if you've got pain going down the arm, coming from the neck, that's something that you need to have looked at and get checked out by somebody who knows what they're doing. So thanks for watching. I hope that's helpful.